Okay, hi everyone, welcome back to this week. First off, Happy New Year. I know 2018 is right around the corner, so that's great. So that's a great time for everyone to start with new healthy goals, and I know everyone starts to work on their diets and the gym, so that's great. And it'll be great to see what you guys have for your New Year's resolutions, so you guys can always comment about that. I like reading what other people's goals are, so it's nice to see what everyone wants to accomplish in the new year. So I thought, this week I would talk about rib pain. I've noticed a lot more people are coming in with this condition, and there is a lot of misconceptions around what rib pain is and what's deemed more serious and what is a condition that we can help with as chiropractors. So I thought it'd be a little quick video to just go over that. So I'll explain what the ribs are and what kind of joints they make, and then what could be the causes of rib pain, and then what we can do to help with a specific rib disorder. All right, so the first thing is we've got 12 ribs. They make a joint in the front, so with your sternum, and with the back in the spine as well. So there is a costovertebral, transverse joint in the back, and then they attach to the sternum in the front. Minus the last two ribs are called floating ribs because they don't attach to the front, they only attach to the back. So with that, the main purpose of having ribs is to protect the heart and the lungs. It creates a rib cage around, and it helps us to breathe. So with the intercostal muscles, it helps to actually, take in a lot of air into the lungs, and the ribs move in and out as we breathe. So that's what the purpose of having ribs are. Now, when there's rib pain, what usually happens is it's hard to breathe. A lot of people will say that it hurts when they twist their body, or even it's tender or it's swollen around that specific area. So that's kind of how the rib pain presents. And now the causes there are a lot, and then there are some that are more musculoskeletal in nature. So a common one is rib fractures, sometimes with direct trauma. It could be due to a sports injury or a fall right onto the rib. A bruised rib is quite common too. Like I mentioned, there are muscles in between the ribs, so it could be a pulled muscle that causes this pain. Inflamed cartilage, because when the ribs attach to the front on the sternum or in the back on the spine, there's also cartilage in between that helps protect and cushion the ribs, so that can be inflamed as well, known as costochondritis, so that's another condition. Sometimes it could be nerve irritation, intercostal nerves, organ pain. That's why a lot of people get more concerned, because the common perception is that you're getting rib pain. It could be a heart condition, it could be related to that. So it's always good to take these things seriously, because if it's not musculoskeletal in nature, then yeah, it could be something more internal. It could be a heart issue, it could be a lung issue. So definitely it's not something that you should brush under the rug. It's definitely something that you should check out from an experienced health practitioner. Another one is also esophageal condition, so that could be something going on in the throat. So that's another one as well. But however, if it is something like a bruised rib or pulled muscle, or also the joints out of place, what we call a subluxation, sometimes you'll hear people say, "Oh, my rib is out." They can actually feel it, and it presents as a local pain. You can usually feel it, that it's bumpy and it's not feeling in the right place, and it's sometimes swollen. So that's something that we can help with. Chiropractic adjustments are great for that, because we just adjust right into the area. Usually you get immediate relief, so that's great. And then a little bit of muscle therapy can help as well. So that's kind of what we can help with. And I like treating ribs personally, because it's kind of the few conditions that patients get immediate satisfaction, that they notice right away that it feels a lot better. So it's a quick kind of result. And then again, of course, you always want to follow up after, just to see if everything is settling in place. But ribs are awesome to treat. I find a lot of good results with it. So if you know anyone, or you're, are suffering from rib pain, or a rib out of place, definitely you can go to a chiropractor. We can treat this. It's quite common, and we can help you feeling better. So if you have any questions or comments, definitely comment below. Let me know what you guys want for the next topic, or in the new year, so I can look at those comments, and then we'll go from there. So we'll hope everyone has a great new year, and I'll see you next week. Bye.